For the second half of lecture 2, we're going to talk about chapter 4, which is on mobility, balance, and posture. And optimizing mobility should be one of our primary considerations when we're prescribing physical fitness. This is like our foundation, and being able to move well. If we can't move well, then we're building our house on a poor foundation. So when we talk about mobility, in the past, exercise professionals and researchers tended to focus more on flexibility, believing that simply stretching our muscles would improve our movement and reduce our chance of injury. But we're going to talk about how that's not necessarily the case. Mobility is the combination of our muscle strength and length, as well as the connective tissue quality and motor control. And this is a key concept. So mobility is not the same as flexibility, although we do require a certain amount of flexibility to move efficiently or have good mobility. We want to remember that mobility combines those elements of having adequate tissue length, but also strength through that full range of motion. As if we're weak in certain movements, we're not going to be able to move safely and freely. We'll see over the course, especially in lab, that I have very poor flexibility, but I have adequate mobility to be successful at the sports that I most frequently do. Could I maybe have more success if I had greater flexibility and therefore more mobility? Perhaps, but if I just increased my flexibility, I need to work very hard on strengthening through that increased range of motion, as well as my motor control through that increased range. Otherwise, I won't be able to safely move through that increased range of motion. Now that we've talked about how important mobility is and how it differs from flexibility, we are going to talk about flexibility for a little bit because the American College of Sports Medicine and CSEP, the Canadian Society of Exercise Physiologists, still use the term flexibility and still describe how to stretch muscles. So we'll talk about it first. So flexibility is how the tissues allow the joint to move through its range of motion without injury. We talked about that on the last slide. Static flexibility is passive, so the muscle's not contracting. Whereas active or dynamic flexibility is range of motion during active movement. So the muscles are contracting while we go through these movements, often to the end range or close to the end range. So flow yoga would be an example where we're bringing our joints close to the end range of their motion and we're just holding it for a few seconds. Now, being more flexible at a joint is not necessarily better or decrease your risk of injury, particularly if we don't have stability or aren't strong through that full range of motion. Again, we're going to talk about how being more flexible actually doesn't necessarily decrease your risk of injury. Now, how do we measure flexibility or what things can affect flexibility? The joint structure can affect how flexible our joint is. For example, our ball and socket joints in the shoulder it can move in all planes and have a greater range of motion. Whereas the hip joint, which is also ball and socket, tends to be a lot more stable and therefore have decreased range of motion. Young people tend to be more flexible due to higher levels of activity overall. So loss of flexibility can be associated with a reduction in physical activity. In general, people that are more active tend to be more flexible than people that are inactive. But if we have somebody that's doing lots of resistance training, building muscle bulk through only limited ranges of motion, it may in fact decrease their range of motion. And people can also lose static flexibility from workplace or sport-specific positions and or repetitive movements. So our are rotational sport athletes, where they're always twisting in one direction, like golfers or hockey players. They may increase mobility in one direction but decrease it in another. And then certainly somebody that's being inactive, sitting at a desk for years and years, we're going to see muscle imbalances, and that may decrease their flexibility. If you remember our FIT principle, our frequency, intensity, time, and type, on this slide we're going to discuss frequency, intensity, and time, and then we're going to spend quite a bit more time on the next slide talking about the type of flexibility. So we'll begin with frequency and the short-term effects of stretching to improve flexibility, i.e. increasing our muscle length. Those are temporary, and those effects tend to be greatest immediately after a stretching session. If we want more chronic or lasting changes, then we need to do flexibility on a regular basis, therefore at a greater frequency. As with our exercises, our cardiorespiratory fitness, our strength training, we don't want to do our flexibility training cold. So it's best performed after our physical training when our muscles and joints are already warmed up. If you're just going to be doing a flexibility training session without any strength or cardiorespiratory fitness included, then you still need to warm up a bit first. For intensity, can we quantify intensity for flexibility training? Short answer is no. We can't prescribe a certain intensity like we could with cardiorespiratory fitness, where we're prescribing a percentage of their max heart rate or a percentage of their VO2 max, or with our strength training, we're prescribing a certain number of reps and sets. The reason for that is, in terms of flexibility, the intensity of stretching is subjective and it's related to that person's sensation. So it's going to be different from person to person. For time, our recommendations are as they are here on the slide. So you want between 2 to 4 repetitions, totaling 60 seconds for each flexibility stretch that you do. So if you're performing 2 repetitions of each stretch, you'd hold each of those for 30 seconds. If you're doing 3 repetitions, you could hold each for 20 seconds. If you're doing 4 reps, hold each for 15 seconds. Now we're going to move on to type of flexibility. And we divide these into 3 main categories, those being static, dynamic, and PNF, or proprioceptive neuromuscular facilitation flexibility training. So we'll talk about static first. With static, we tend to lengthen the muscle and hold that stretch for 10 to 30 seconds, usually 20 seconds is the most common. The stretch is going to be uncomfortable, but over time, we receive less feedback from our tension receptors within the muscles, so the Golgi tendon organs, the muscle spindles. And if it's done consistently over time, then the muscle can lengthen somewhat. And we can further divide our static stretching into passive static, and that's where there's an external force putting the stretch on the muscle. So if you were laying on the ground and I lifted your leg, kept straight, lifted it up off the ground, eventually you're going to feel a stretch in your hamstrings. Active static is where we have active contraction of one muscle group, the agonist muscle group. So remember, the agonist is the group that's contracting. Think about that muscle group being in agony because it's having to move. So the agonist muscle group moves the body into a position that stretches the antagonist muscle. So if you're laying on your back and you raise your straight leg off the ground, the agonist would be your hip flexors. And if you continue to raise that leg up off the ground, eventually you're going to feel a stretch in your hamstrings, and that would be the antagonist muscle group. Next, we'll move into dynamic stretching. And dynamic stretching, we're actively moving the muscle into a stretched position. We typically hold that stretch for 1 to 2 seconds. So that's that's kind of a key point there. With our dynamic stretching, we're not holding it very long. And that's why we can include dynamic stretching in our dynamic warm-up. We don't want to do static stretching during a dynamic warm-up because the static stretches kind of tells the muscle that it's time to relax, or it shuts the muscle off. And then lastly, we're going to talk about our PNF stretching, or proprioceptive neuromuscular facilitation. And PNF, it plays with the influence that the central nervous system has on our ability to relax our muscles. When we're doing a static stretch, the central nervous system introduces some tension in the muscle to protect it from being overstretched. And that's called our monosynaptic stretch reflex. Monosynaptic stretch reflex. So it's a reflex. It's beyond our control. Think about if you are having your reflexes checked at your knee, your patellar tendon. The person testing will hit the patellar tendon with a reflex hammer. There'll be stretch applied through the tendon. The body senses that, and it's worried that it's going to continue to stretch and maybe cause damage to those tissues. So reflexively, the signal is sent to the spinal cord and then right back to the muscle. So it doesn't go up to the brain where you perceive it. It's a reflex, so to the spinal cord, back to the muscle, and right away it tells the quadriceps to contract, to straighten your leg out, to decrease that stretch through the tendon. So there's a couple of forms of PNF stretching. We'll talk about one first. So for both forms, PNF utilizes contract and relax stretching. So we'd slowly go into a static stretch of a muscle group. Remember, if we went too quickly, it would engage that monosynaptic stretch reflex. And we hold the stretch. So again, think about if we want to stretch our hamstrings, if we're laying on the ground and we lean our torso or body forward, we're going to feel a stretch in our hamstrings. So we hold that static stretch in the hamstrings for about 20 seconds. And then we're going to isometrically contract that muscle group. So contract our hamstrings. So we could try to push our heel down into the ground, and in the process contract our hamstrings. We don't want to contract it as hard as we possibly can, so about 30% of our max power. And we'll hold that contraction for about 5 or 6 seconds. And that sustained contraction causes the Golgi tendon organs to relax. And then after that 5 or 6 seconds of that isometric contraction, then we're going to apply our static stretch through that same muscle group again. So static stretch through the hamstrings, and we'll hold it for 20 to 30 seconds. And because the Golgi tendon organ has relaxed, it allows us to stretch the muscle a little bit further. So there's pros and cons to our PNF stretching. The pros is that it's the most effective way to lengthen our muscle and tendon, and it helps create functional range of motion. It helps us move through a range that we still have strength within. And cons would be it takes more time to do this. We often need the help of somebody else, and we're going to do partner PNF stretching in lab today. It's uncomfortable. It doesn't feel great. And if we do it incorrectly, there is the potential for injury. So if your partner moves your legs into the stretch position, static stretch position too quickly, we can strain the muscle. But now that we've talked about developing flexibility, remember our flexibility training can increase tissue length, but that might not be a good thing for our client. Our client's problem might be not that they're too tight, it might be that they lack the strength and their ability to stabilize in that end range of motion. So we'll get into that a bit further, but here again are our different forms of developing flexibility. So our static stretches, we pull the muscle into its end range and we hold that typically for 20 seconds or so. Our next example are active static stretching. So we're actively contracting one muscle group to apply stretch to the opposite muscle group or opposing muscle group. And we'll get into our agonists and antagonists again. So in this picture, the individual is actively contracting their hip flexors and their adductors or groin muscles. So those would be the agonist muscles. And they're doing that so that they can stretch out their hamstrings and their glutes. And in that case, those would be the antagonist muscles. We can also see in the upper body with the arm, they're pushing downwards into the ground, utilizing their lats and their posterior deltoid. So those would be the agonist muscles. And they're doing that to stretch out the opposite side of the joint, the pecs and the anterior deltoid muscles. So those would be the antagonist muscles. Your dynamic stretches, again, we're going into a position to stretch the muscles, stretch the joint capsule, but we typically only hold that for 1 to 2 seconds, and we move out of that position, and so these are included in our dynamic warm-up. Now I mentioned with our PNF stretching that there's a couple of different forms with it, and the picture on the left, this is the method that we talked about on the earlier slide. This involves autogenic inhibition. And it's of the same muscle that's being stretched. So we can see in the picture the muscle group is positioned so that the muscles are stretched and under tension. In this case, the hamstrings, so they're using assistance from their arms to pull the straight leg up until they feel a stretch in their hamstrings. They're going to hold that static stretch for 20 seconds or so. And then they're going to contract their hamstrings. So they're going to try and push their leg down towards the ground. The band around the foot is going to resist that movement. So it's an isometric contraction of the hamstrings. And then they're going to relax that contraction and they're going to pull the leg a little bit higher up towards their head to increase the stretch in the hamstring. So during that isometric contraction, it's going to cause the Golgi tendon organs to relax slightly, so it allows a further stretch of the hamstrings when they pull the leg back up towards their head. We'll typically, after each of these stretches, allow them 30 seconds to recover, and we'll repeat that stretch 2 to 4 times. On the right, still PNF stretching, just slightly different, and this method utilizes our principle of reciprocal inhibition. So in this case, we would, if they were stretching their hamstrings, they do the static stretch of the hamstrings first. So the leg is brought into that position where it is statically stretching the hamstrings. And then we would get them to contract the agonist muscle, so the muscle on the opposite side. In this case, it would be the hip flexors and our quads, get them to contract that muscle. And when we contract muscles on one side of body or joint, it reflexively tells the muscles on the opposite side to relax, and that's where our reciprocal inhibition comes in. So when we contract our hip flexors, quads, it tells the hamstrings to relax. So we hold that quad contraction and hip flexor contraction for 5 to 6 seconds, and then we pull the leg up towards our head to increase the stretch through the hamstrings again. So that's our reciprocal inhibition PNF stretching. Now we're going to move on and talk about neuromotor exercises. And neuromotor exercises is a new area, so we don't have a lot of research or evidence-based recommendations in this area as compared to our cardiorespiratory fitness or strength training or flexibility, even when it comes to frequency, intensity, or type. Neuromotor exercises involve balance and agility, coordination, and gait, and the general recommendation is that it's been performed 2 to 3 days per week for 20 to 30 minutes each time, and you want to do activities that challenge the range of motion and balance of multiple joints at the same time. So, for example, yoga. And it's particularly important for older individuals in order to decrease the risk of falls and also train the response of their joints and muscles once a fall is starting. So why has there been this sudden shift in interest to neuromotor training or free weight training, and that's where the weights are free to move in space, such as using dumbbells or barbells or kettlebells or even body weight resistance training that challenges our neuromotor system. Why don't we just let people continue with machine training? Because we still can increase our strength using machines. And with the machine training, often the movement is controlled. We can't deviate the movement at all. It's moving within a controlled range. Well, the reason we're more interested in our neuromotor training or free weight training is that it's more functional. It more replicates how we use our muscles in real life. It challenges multiple joints and muscles at the same time. So if we look at examining movement further, if a client moves poorly, what could be the cause? If the problem is truly a lack of flexibility or mobility, or is the problem due to their motor control? Can they not control their joint position? So if we simply assess tissue length, it doesn't give us a lot of information about how they can control a movement pattern. So we need to watch them go through the movements carefully and observe what they're controlling well and what movements maybe they lack a bit of control. And often the dysfunctional movements occur because the spine or that limb can't be stabilized, and the body tries to protect itself by limiting its range of motion or compensate with poor movement mechanics. So a key point is our clients or our athletes, they need to be able to control their movement before we add any load or we increase the speed of the movement. That simply should just make sense. If you can't control the movement of your joint and you add more load to it with free weights, or you try to perform that movement quicker, you're going to injure yourself. But on the next slide, we'll look at a false observation about someone that we suspect has tight hamstrings. So in this image on the left, we can see our active straight leg raise. So they're keeping their leg straight, the knee extended, then they're lifting the heel up off the ground. Our agonist muscle in this case would be our hip flexors or quads. And we can see that they get to about 65 degrees. Ideally, we want people just a little bit higher, up to 70 degrees. So we suspect that because they can't reach that 70 degrees, they must have some hamstring tightness, and it's limiting their active straight leg raise. But on the right, when we do passive straight leg raise, so we bring the leg up for them, we can see that they get close to 90 degrees. So it's not hamstring tightness that was limiting them on the left. It's something else that's limiting their ability to move actively. And often that's a lack of control of their surrounding joints. Now, if we did my active straight leg raise, it'd be somewhere around 45 degrees. But if we did my passive straight leg raise, it would be around 50 degrees. So there probably is some lack of motor control in my pelvis, but a big part for me is hamstring tightness, because we don't get much more movement passively than what I could do actively. So if you found that your straight leg raise was limited and you stretched your hamstrings, it may not solve the problem. So as mentioned on the earlier slide, it might be more about motor control of the surrounding joints. So if you increase length in the muscle, in this case the hamstrings, it's not going to solve their motor control problem. The body will respond by causing the muscle just to tighten back up, because it senses that the movement at the joint, in this case the hip joint and the pelvis, is still unstable. And also, if there's tightness on one side of the joint, there's often corresponding tightness on the opposite side of the joint, often a little bit higher or a little bit lower on the opposite side of the joint. So if we have tight hamstrings, often our hip flexors So on the anterior surface of the joint and above the hip joint are going to be tight as well. So if we just increase the length of our hamstring, we're not addressing the problem of the tight hip flexors on the opposite side of the joint. It also can be a problem with strength along the kinetic chain. And in the second half of chapter 4, we'll talk about how our tissues slide past one another, and tightness and weakness in one area of the kinetic chain can be passed along higher up or lower down the kinetic chain. So some of our key concepts we talked about so far. If you're working with an athlete or client, we need to check their joint position and joint mechanics first. And we'll start with that as early as today with our push-up mechanics in labs. And we have to address our improper movement mechanics first. Only when they can move efficiently and safely without any weight, then and only then can we start to load the joints. So our movement mechanics, it's a balance between mobility and stability. So they have to be stable through their movement in order to safely move through or have mobility through that joint. You might have some clients who have hypermobility, so they have lots of range of motion in the joint, but they can't stabilize in those extremes of movement, and therefore they risk injury. Or you have other people who are very stable with their movement, but they're so tight that they can't get into certain positions, and that's me. You'll see that with my squat mechanics and deadlift mechanics, that I can't go through a proper range of motion because I don't have the flexibility or more mobility. So as you might guess, assessing movement mechanics and what techniques we can use to correct improper movement mechanics, it can take years and years of practice. But don't worry, you will get there. And there's things that you can suggest right away that can make a big difference, even after a few classes. So simple suggestions for improvement. Like in the lab, when we've done our body weight squats, you've heard Vinny say to open up your chest and keep your shoulders back. Well, that in itself helps prevent people from rounding their low back, which is a faulty movement pattern that can contribute to injury, especially when we start adding load to those individuals, or keeping your feet shoulder width apart or just slightly greater than shoulder width when we're doing squats. That increases the base of support, increases our stability, decreases the chance of fall. So simple suggestions like that can make a big difference. In the second half of chapter 4, we're going to get into more of assessing and changing our movement mechanics.